All right, well, welcome everyone. Thanks for joining this panel on the politics of coronavirus. For those of you who don't know me, I'm Associate Professor Benjamin Isakhan, and I lead this group called Polis that's hosting today's event. Before we get started, there's just a couple of housekeeping things to keep in mind. This is, for many of us, it sounds like the first time we've used Zoom. So just bear with us if we have technical difficulties or I drop out or anything like that. We should be able to get back on top of it, but just be patient. Please keep your microphone on mute unless you're the speaker. I can see most of you have done that already, but if you haven't, please do it so that we don't sort of cross our wires and it just becomes a bit chaotic. I was saying this earlier, but for those of you who've just joined us, if you want to ask a question, I actually don't know where it is, but there's a live chat function in here somewhere, and I'll try and find it. If you can drop your question in there, I'll try and curate those questions and put them to the speakers at the end of the session and see how we go with that. I think if we open it up to general discussion, it again will become just a bit of a mess. I also have been asked to point out that we're not speaking on behalf of Deakin University and we're not commenting at all on Deakin's response to the virus. And also that it's important from the outset for anyone listening in that we're not health professionals and we're not here to comment, and we have no expertise or information on the virus itself. Rather, what we are here to discuss, as I said, is the political environment and the changing and evolving political environment around this virus. And so what I think has been, and we want to acknowledge the very real human suffering that's going on. I think one thing that has been underreported, if you like, or not widely commented on, is the ways in which these kind of global pandemics play into very complicated geopolitical realities. And we're going to have a look at a few examples today. So we're joined today by 5 of my very esteemed colleagues. Many of you will know them. Chengxin Pan, Associate Professor Chengxin Pan, will talk to us about China. Dr. Danielle Chubb will talk about North Korea. Dr. James Barry will talk about Iran. Dr. Matteo Vergani will talk about Italy. And Dr. Sam Balaton-Chrimes will talk about Kenya. I'm going to ask them to talk for about 10 minutes each without any interruption from me. So we'll just go one in order and then we'll try and do some Q&A as best we can given the sort of technology at the end. And yeah, we'll just see how this goes. So welcome again to our very first Zoom event as Polis. And I'm going to hand it straight over to Cheng.
Okay, thank you, Ben, and thanks everyone for joining in. I'm the first timer for Zoom meeting. So, can you see my screen now? Okay, let's get back. Now, let's zoom in on to China. We know China has been called the epicenter of COVID-19. And if we look at this map, hopefully it's coming up quickly. So Wuhan is somewhere here on the Yangtze River. Now, I think given the title is about the politics of coronavirus, and it's interesting to know how China's political system is being tested by the virus, by the outbreak. But I think my starting point actually is not about the political system as such, but the healthcare system, because this is the most directly related to this pandemic. China's health system, basically they're about more than 95% of the population are covered by the basic health insurance. The government's goal is to make it 100% by this year. And also they are trying to increase the cost covered by insurance to 70%. Currently, it's anywhere ranging from 30 to 80%. And the health system is, of course, linked to the political system. When we talk about the political system, we tend to see countries in terms of a democracy or authoritarian system, etc. But I think this, given in this context, this need to go beyond this, basically the dominant or even one-dimensional lens to look at countries. If we start with this kind of rights-based approach, China has been known as an authoritarian, non-democratic, even totalitarian, etc. But from a responsibility, what I call responsibility-based approach, China has other features or qualities in its political system, such as sometimes it's called a developmental state or welfare state. And also, if you look at the composition of the country, China is a unitary state. This is in comparison to the federal system in Australia, for example. And so that's a quick overview of the China's political system. In terms of the outbreak of COVID-19, I think we have know a lot about this, where it started. The first ever, one of the first cases, known cases in retrospectively, was discovered on the 10th of December last year. Most of the cases were connected to the Wuhan seafood market. And currently the infection and the cases in China, as you can see, probably it's too small to see. But the current case is about 81,000 cases, about 3,261 deaths. Now, turn to the handling of this crisis by the Chinese authorities. There has been much debate over whether China has bungled this crisis, this challenge, or whether China has redeemed itself by acting decisively, at least from late January and onwards, to keep the virus under control within China. As you can see from this those headlines, there are mixed opinions depending on who you are talking to or the news platforms. On the left side, this is a very sketchy timeline of the outbreaks and the responses from China. And I have to say, initially, the responses were made mostly from the Hubei province and Wuhan Health Commission, so the officials from the local level, the city level, and the provincial level. And by the 7th of January, the central government became more actively involved. And so by the 9th of January, China announced that this was a new virus behind the outbreak. And now by the 22nd of January, Wuhan was in lockdown. So that was 2 days after the confirmation by the Chinese leading authority on this kind of a virus, Dr. Zhong Nanshan, that this disease or this virus could be transmitted from person to person. Now, what does this say about the Chinese political system? To quote Chinese Premier Zhou Enlai in the 1970s, he famously told the visiting French delegation about the significance of the French Revolution. His reply was, it's too soon to tell. I think given that we are still in the midst of this crisis, I think it's fair to say, indeed, it's really too soon to tell. And also, I think this crisis might not be the best litmus test for either a democratic system or authoritarian system, because both systems, as we may have seen, have made errors, mistakes. They had their cover-ups in China, also in the United States, and maybe in other countries as well. But also both systems have had shown their strengths to deal with this kind of crisis. Having said that, this is not to equate these two systems to basically mean they are equal or somehow there's no difference between these two. Of course not. My point is that this is not this kind of a red test to differentiate these two systems. I think the more relevant question might be to compare the welfare state and the neoliberal state. I think there is something to be said between China and other countries. We know China called itself a socialist country. Although in the past few decades, China has moved a long way towards this neoliberal state, but still there's some kind of a mixture between the two present in the Chinese system. So I think this China's ability to respond to the crisis, especially in the last few weeks, demonstrates that its recent focus on welfare, on building the so-called harmonious society, have cushioned its this kind of crisis, showed its ability to respond when those more free market-based states are struggling to respond with the demand for resources, for manpower, for technology, etc. And also this crisis shows the differences among societies, among different cultures, and the use of the attitudes and the use of technology and governance in general. So it's really hard to judge the system on this kind of a crisis or challenge. And my takeaway point also, I think we need to question whether there is such thing as a one-size-fits-all model, political model in governing society, in delivering welfare, or do we need for regime flexibility, resilience, and adaptability? So, but having said that, I think the Chinese state probably is not well known for its adaptability. And I will show you a few slides about the Chinese Communist Party's mouthpiece, the People's Daily. So from the 1st of January this year until the 22nd or 20th, all the front page, the headlines, most of the headlines were about Xi Jinping. The message is totally different from the current. If you read the newspaper, you wouldn't know there's such thing as the virus going on. Not until the 21st of January, on the right upper right corner, the news began to appear on the front page. And a few days later, Xi Jinping convened this the Chinese Political Bureau Standing Committee conference to discuss this crisis. So that's the, as you can see, this slow response in this process. So now I think that's a quick overview of what's happening in China. As I said before, this much we do not know, so I do not pretend that this is the whole picture. Lastly, because I am from international relations background, so I'd like to talk about some of the implications for international relations. I think this crisis really has shone light on the role of the state versus market. We know this is an ongoing debate in the political economy field. And also, we need to rethink the framework about regime type in understanding politics, international relations, because we know regime type has become this kind of a shorthand for understanding peace, security, human rights, etc. But I think this kind of crisis really shows that there's no clear-cut answers if we try to find those answers in regime type. And also, as you may all know, the naming of the crisis, the virus, is deeply political. It has been politicized in many parts by government officials and by Donald Trump himself. He repeatedly called this the Chinese virus. And also the racialization of this such common challenge, such as the COVID-19. I'm sure we have come across those kind of instances, or at least read news about those attacks on people with Asian background, etc. And finally, I think we need to rethink power, geopolitics, great power competition in international relations. This has been the favorite areas of many scholars, especially many people are talking about the return of the new the geopolitics, the starting of the new Cold War. But this global pandemic, hopefully, I think has alerted us that international relations is not just about power competition. It's much more complex than that. So I will stop here. Thank you.
Over to you, Danielle, when you're ready.
Okay, sorry, I wasn't sure if I should wait for moderator. All right, I'm going to talk about North Korea. I will set my timer so I don't go over time, because 10 minutes isn't very long. Please stop me if I go over. I don't have a PowerPoint, but I will share a photo with you all, because why not? So can you all see that? All right. Can you guys see the photo that I shared? I'm going to take it you can.
Yes.
Thank you. All right. So very briefly, North Korea's political system, I don't think I need to spend much time on. It is, as I'm sure everyone knows, a tightly controlled political system. Makes China look like a liberal democratic state. It's been described by Human Rights Watch, for example, as one of the world's most repressive state. And the government, under the current leadership of Kim Jong-un, exercises what I think is best described as almost complete control. And for us, this includes, like for this conversation, it includes importantly things like control over information, over freedom of movement, both in and out of the country and out and within the country. And it also includes control. It also has a lot of control over access to healthcare for its citizens. So I'd say that the political system in North Korea, as it is, has two main implications for COVID. The first is that the country has actually little trouble controlling its population and implementing severe restrictions that other states might be reluctant to place on its citizens because of the what it would mean for their livelihood, as we've seen in Australia. But also it means that the lack of free and transparent information does make it difficult for the rest of the world to understand what's going on inside there. So everything I say, as I think is always the case when anyone talks about North Korea, is at least 60, 70% speculation, well-informed speculation perhaps. So as a centralised regime, North Korea has been able to both enforce containment and control, but also contain the messaging. What's the situation right now? There've been, as far as I can tell, and I don't think there's been any updates to this in the past 12 hours, no cases of COVID-19 reported inside North Korea. That's the official report. However, given the large number of cases in neighbouring countries, in China and South Korea, it's very hard to imagine that this is accurate. And there have been a number of unofficial reports that there has been some outbreaks in North Korea, although these might be relatively minor. So 2 reasons that this is the case, that we don't think there are any reports and that we don't know, is first, state control of the messaging is the most obvious reason, that North Korea wants everyone to believe that there's no cases in North Korea, and until it got to a point where North Korea required outside assistance, it would continue to put forward that message, I would think. But another more concerning that some medical experts familiar with North Korea have posited is that there is a significant lack of diagnostic capability in North Korea, and it remains open to question whether North Korea has in fact the capacity to accurately test. It's unknown whether it can actually accurately test for COVID-19 at the moment. And humanitarian organisations are working on this, and I'll get to that in a moment. So what North Korea has done, it was one of the first countries in the world to announce a total closure of its border. When its response to SARS and to Ebola are helpful to think about here, it also closed its countries down in response to both those outbreaks, but in a much more staggered way. When it comes to COVID-19, there was basically a complete shutdown of the border very early on. On the 21st of January, it told tourism countries that no more foreign tourists were to enter the country. This was followed shortly by severe travel restrictions on all travel in and out, some suspension of flights from China and Russia, and then an immediate compulsory quarantine of all foreigners in the country. So foreigners in the country couldn't move, even out of the country. They were first under quarantine for 2 weeks, and then it was extended to 30 days. And then in early March, they were let out of quarantine, and a lot of those foreigners, including embassy officials, left the country. So some embassies are still operating and some have suspended their operations for now. I believe there's one entry point that remains open, the Dandong to Siniju one, one of the border crossings with China. But we're unclear what is actually going on there, but there are certainly, in the best case, lengthy delays going into North Korea. The drivers are being put into quarantine on their way in and then put into quarantine on the way out. So delays shipments of supplies, including critical healthcare supplies. But I've seen other reports using satellite imagery that suggest that even though that border is technically still open to freight, that it has closed down. North Korea's healthcare system is probably reasonably good by comparison with other countries that have a similar GDP, but it's still quite limited. So while the country has the healthcare infrastructure, because it's such a centralised economy, to handle a minor health crisis, and people with mild symptoms of COVID-19 could probably be treated, it probably lacks the medical supplies to prevent, diagnose or treat coronavirus. So people with significant complications would go largely untreated. There are very few sophisticated medical supplies. And even where it may have 1 or 2 ventilators in the country, they would be very much limited to a very small section of the elite. And that comes back to the fact that access to North Korea's healthcare system is not on the basis of need, but it's on the basis of a kind of caste system whereby your loyalty and perceived loyalty to the state determines where you live, what kind of job you have, and access to healthcare facilities. And people aren't at the moment, as far as we understand, being able to move around in the country at all, particularly over provincial borders. So I thought I'd talk a little bit about North Korea's political messaging, because while we're speculating wildly over what's going on inside North Korea, I think it's more useful to look at what we can actually see, so we can observe some interesting messaging. if I was to provide a 2-minute analysis of North Korea's internal messaging, or a 30-second one, which I'm about to do, I would say that the message is, guys, we've got this. We are a strong government and we are this is totally under control. We care about, well, maybe not we care about you, but we're going to keep the Korean people safe. We've shut down the borders. Don't move anywhere. It's for the good of everyone. And I had a quick look at KCNA, the North Korean media website, just before this, and the last few reports from North Korean media around the country's response to COVID have been around things like we're amping up our manufacture of antiseptic and disinfectant, and talking about what a great job the regime's doing with that. And certainly North Korea does have a manufacturing capability to be able to do that kind of a thing. The other internal messaging, and that's the picture you can see, is that there was for a while, and as we all know this is changing quickly, there was a really intense and targeted campaign to get everyone in the country wearing face masks. And much to, I think, the enjoyment of many North Korea watchers, a lot of these face masks appeared to be quite badly photoshopped on in a lot of the official photographs that were coming out in the media. So for a while there, all official meetings, everything you saw, there were face masks of people. Some of these photos, you could tell that people were wearing face masks, and others, they weren't. Interestingly, though, I think that has shifted a little bit in the last couple of days. So when we look at the external messaging, North Korea is positioning itself, I think, as being in a position of strength as well. It sent very early on messages of support to South Korea. It also graciously received messages of support from Trump, from the United States, while at the same time stressing that this changes nothing. That while we have these great relationships, or we might have great relationships, while we have, respectful relationships with these foreign leaders, we're still going to do what we want when it comes to our nuclear program. And then they've shown this by conducting a number of tests the last few days. So it's business as usual in North Korea. And there've been a few reports. So North Korea has declared that it's going to hold its spring Supreme People's Assembly in April. And we've seen a number of pictures in the last few days come out. So when they did tests earlier in the month, they had, all of the military personnel were wearing face masks, but just this weekend, the test images that came out, people weren't wearing face masks around Kim Jong-un. And I think that's a very clear, that they're sending a clear message. They're saying our early interventions have been successful. We've put our people under quarantine. And I think that's probably a sign that maybe it hasn't emerged. And then the last 1 or 2 minutes, I'll talk about responding to an outbreak, what the geopolitical climate could mean for any outbreak, and also what the longer term implications are for North Korea of any outbreak. So there's a complex and complicated sanctions regime in place in response to North Korea's nuclear program that in theory allows for exemptions for humanitarian supplies, but in reality has been very difficult to navigate. And there's a consensus view, I would say, from everyone I know who works in the humanitarian space in North Korea that that these sanctions have impacted their work very negatively. The most significant way in which this has occurred is through the financial sanctions, that it's impossible to get money into North Korea. And so humanitarian organisations haven't been able to fund their work, but even supplies have been difficult to get in. So this outbreak is a real test for the sanctions exemption system. And I had a quick look at the UN 1718 Sanctions Committee page. And indeed, it seems that they are actually trying to do their best here. In 2019, that committee only granted 15 humanitarian exemptions for North Korean organisations wishing to take humanitarian supplies in, but there have already been 9 exemptions in 2020, and 3 of them were in 1 week in late February, and they were all COVID related. So it was things like diagnostic items, MSF is trying to get in, the Red Cross has been given exemptions for PPE, for ventilators, it seems, from the WHO, for children and adults. So the sanctions exemption system is working a little bit, and it's good to see that when it has to, that it can work. So I think that's a positive. And then longer term implications, I just want to go back to 2 points. So first of all, a significant element of North Korean population is already at risk. The 2019 UN Needs and Priorities report advised that 40% of the population were undernourished. That's around 11 million people. And North Korea is currently dealing with a significant tuberculosis outbreak. So you can imagine that any COVID-19 outbreak in North Korea would have a devastating impact on the health of North Koreans. And then we also know that These exemptions aside, the North Korean Committee on North Korea, which is based in DC, has reported that some actions have, thanks to Ben, I'll finish up now, have stopped the inflow of money into North Korea. So the way they got around financial sanctions was to physically carry in money, and now that they can't bring in money, humanitarian operations are closing down inside the country.
Okay, James, we'll go straight to you.
Okay, thank you. Can everyone hear me? Yep. So today I'll be talking about Iran. Before I start, I'd just like to say Solid Nol Mubarak for all the Iranians who are celebrating the Persian New Year. It's interesting that, or it's troubling that the virus has broken out during the Iranian New Year, much the same way that it broke out just around the time of the Chinese New Year, which is, I think, the largest movement of people on Earth, annual migration. I know, seeing in the news today, that despite being told not to, people in Tehran and affected provinces are still going on holidays because it's a 2-week shutdown period for holidays during the Persian New Year. But it's much less, but still they estimate about 3 million people have gone on the move, which the government is not happy about. I guess the overall point I want to make today, I've heard a number of people say, look at China, it's an authoritarian system and they've done a great job in containing the virus. We don't know that yet. I mean, who knows what's going to happen next. But Iran is a similar country in the sense that it's a one-party state, which I'll talk a bit about in a moment, that shows that it's not necessarily the case that you have an authoritarian state equals good, excellent handling of a situation like this. So to talk about the political system of Iran, Iran is a one-party state governed by an ideology called Velayat-e which means guardianship of the jurists, essentially meaning that Shia Islamic jurists, politicized clerics, they have the final say on all legislation and government policy. It's a mixture of elected and unelected arms of government, with a parliament that's elected directly. Of course, most of the people who run for parliament are vetted by the senior people in the government. There is an executive, a president that's elected directly, plus unelected arms such as a guardian council, which acts a lot like a senate. And also the supreme leader is the head of state and the most powerful person in the country. He's not elected, of course. He's in that position for life. And the Revolutionary Guard are another important group within Iran. They're a military group, separate from the main army, but they have a lot of power politically, economically, and in other areas as well. So to give an overview of what's happened in Iran, the corona outbreak started in the middle of February, around about the 19th of February is the first time that it was mentioned in the media, and it broke out. The outbreak took place around the city of Qom, which is about an hour and a little bit over an hour from Tehran, and the shrine of Fatimeh Masumeh, who is a minor but still relatively important political figure. But Qom is also the center of the clergy in Iran. So it's an education center, a political power center. Initially, like many things in Iran, the reaction of the government was to suppress it and to act like all was normal. And I'm sure everyone saw the health minister go on TV sweating and coughing, saying there was nothing to worry about. And then a little bit later, it emerges that he has the virus. So it took a little while for them to respond, but it became apparent within a week that there was a serious problem. There was a number of reasons why they didn't react. Part of it is conspiracy thinking, poor overall organization and neglect within government. You also have religious ideology. Immediately they wanted to shut the shrines. One of the reasons why, or people were talking about shutting the shrines, one of the reasons why, of course, it spread from shrines is not only are they sites of pilgrimage, but one of the ways that people act in the shrines is to kiss them. And I think a few of you would have seen the YouTube video, the Twitter video of the guy showing how safe it was. It's similar to what the Orthodox churches are going through at the moment with the communion spoon, and whether you can't get sick from it. That sort of the theological ideas that hampered a lot of the stopping of shutting Qom down. Qom is very close to Tehran, so Tehran is a city of upwards to 15 million people. It's moved also to Gilan, which is a province in the north of Tehran, which is a large tourist site. So, and the governor of Gilan has been trying to stop people from going there, but it's spread there very quickly. So apart from these, there's a need to maintain appearances. There were distractions it was distracted by other problems. There's political objectives that were happening around the same time as the outbreak. There was an election for the parliament taking place, which had a poor turnout. Now, the Iranian government sees poor turnouts as, it interprets them as kind of like a referendum into the support for the government. And they more or less force people to turn out. You can lose your job if you don't turn up and show that to your boss that you voted. But people just didn't turn up. From people I know in Iran who I've been talking to, the situation is very bad there at the moment. The president has come out and said that he's expecting in the next couple of weeks they'll be lifting the isolation bans. But overall, people are quite afraid, and the reported death toll is I think 1,600 at the moment, or above that, and number of people infected is more than 20,000. A lot of people believe it's much worse, and you may have seen news reports about how mass graves or grave sites are being built near Qom and other places. An important thing to say, though, is people in Iran have been through situations like this before, at least older people, through the revelation and also the Iran-Iraq war. People are used to shortages. They're used to being forced to stay indoors. They're used to strict measures being imposed at a moment's notice. Particularly people who are, say, my age and older, they would know about this. They would know the feeling. So there is some degree of community resilience in that regard. And you probably have seen the videos that have been going around of the nurses dancing, which, look, when I first saw it, I thought that's definitely state-produced. I'm not sure if you're familiar with Narges Barjoli, but she's written a book about this, how the Iranian government produces material like this for propaganda purposes. I felt that it was state-produced to lift spirits a little bit, but obviously some of it isn't, and I have no evidence that it is state-produced, so I can't really back that up with anything, but it's just, I guess you'd say, a professional intuition. In addition to this is the issue of sanctions. Overnight, the Ayatollah Khamenei, who is the supreme leader, made a speech in which he said that they wouldn't accept any help from the United States. And also, he made a number of comments critical of the United States, and he brought up some conspiracies that they'd actually started the virus. Now, the sanctions don't actually inhibit medication being imported to Iran, but they're not against medication, but they do inhibit it, by the fact that a lot of companies won't trade with Iran because of the sanctions. They don't want to be blacklisted. If you've been to Iran, you may have seen, particularly around the Tehran Bazaar, if you're in Tehran, people standing on the streets saying daru, selling medication. Well, daru means drugs, but it's people selling medication that you can't ordinarily get, black market. So Khamenei gave a Nowruz address, a New Year address. He gave two. He usually gives two. He usually gives this at the Imam Reza Shrine in Mashhad. Of course, that's not going to take place in a time like this. So he's just been giving television addresses. He, of course, said that they're not going to accept US help. I would be surprised if there wasn't some communication between the US through a back channel happening at the moment, considering how bad the situation is. And you need to keep in mind with Khamenei what he says. During the nuclear negotiations, he was saying there is no way we're going to negotiate with the United States. There's no point in it. And also after the agreement came into being, he also said that there's no point in doing this. But so essentially, he says one thing publicly, but he allows it to happen behind the scenes, I guess is what I'm getting at. Now, what does this, given this is a policy seminar, what does this say about the political system? Well, I think that in the previous talk about China, the idea of society, culture, technology, and governance as being factors is very important in the Iranian case. I think the political culture, which inhibited the outbreak, and the religious culture did lead to some problems. Religious culture meaning in a political sense. It did cause some problems here. I also think that the general trust, the deficit of trust in people for the government has led to some of the problems, because if you've been following the news, you would have seen Iran has had a number of problems in the past 12 months. There was an end of an oil subsidy, which led to large-scale riots. A lot of people were arrested. Many of those people have now been released as a result of this virus, as they've opened the prisons up. But also there was the assassination of General Soleimani in Iraq by the United States. and the subsequent shooting down of a passenger plane by the Iranians. This caused a lot of people in Iran to say, especially after shooting down the passenger plane, when initially they said they hadn't done it, it was done by somebody else or by the US, or it was a crash. And then they admitted to the fact that they had shot it down. That did lead, even amongst supporters of the Supreme Leader, to a real revelation of they lied to us. So that is the immediate context for which this coronavirus has appeared in Iran. And the deficit of trust is one of the main issues that is affecting how people have reacted to it, and also the spread of the virus. Like I said before at the beginning of the talk, despite being told not to, 3 million people have left Tehran and traveled around to have holidays. Now, this is, talk about centralized regimes and containment. Iran is a centralized regime. They haven't really been able to contain it. Some of the matters are out of their hands, like issues like at times like Nowruz. But also this is, there's ongoing problems that also lead to this as well. Actually, I don't have time to really go into that, but I can talk about it in the questions. Finally, the one thing I want to say is that nationalism is always present in Iran. It's quite strong. And you do see in some of the videos that are coming out of Iran, a real emphasis on the Iranian national spirit in a very similar way to what you would see with in many countries, the British bulldog of Winston Churchill and the rest of it, but its own Iranian character. Anyway, I'll leave it at that. That's most of what I wanted to say. So thank you.
Thank you, James. And we'll pass straight over to Matteo.
Thank you, Ben. And thank you all. I hope you can hear me. So let me start. Well, I feel strange because I am the first person to talk about a democracy in this moment. And I don't have any good news, unfortunately. Maybe we should have chosen, I don't know, South Korea to have some better news, but Italy, not really. So look, there are some political conflicts, I think, that are structural and shape the way in which Italy has handled coronavirus and the emergency. So first of all, regions have strong autonomies in managing the healthcare system. And there is a clash between, or an overlap of decisions between, and a conflict of decisions between regions and central government. On top of these, unfortunately, there are different coalitions and parties in power between regions and central government. So in the central government, we have a coalition between a center-left party and the Five-Star Movement. And in the regions that are more severely hit by the coronavirus, especially Lombardy, there is a administration of right, center-right, led by the Northern League, which is a right-wing anti-immigrant populist party. So, and they are in competition with the central government. So these conflicts are kind of shaping the way in which Italy has been dealing with the emergency. Italy, unfortunately, is the second country in absolute numbers per total cases, following second to China, but it's the first country per number of deaths. Deaths have been rising until Saturday. Now it seems that on Sunday there was a slight decrease in the number of deaths. So Saturday we had 793 deaths, and on Sunday 651. So incredibly high, but decreasing for the first time. The outbreak is in one region, Lombardy region, which has still the overwhelming majority of cases and deaths. And this is important to know because yes, the outbreak exploded in Lombardy, but there were other outbreaks pretty soon in different regions, which were handled differently, and the outcomes were enormously different. So in Lombardy, we have an incredible need of patients that need respirators and intensive care units, more than what is currently available, more than the doctors that are available, more than the physical spaces in hospitals. So doctors had to choose which patients to save, literally, and others were left to die. So why has the outbreak been so bad in Italy? Well, some people say the reason is mainly that there is an old population. Okay, the average age is very high. True, for sure, but this is not the full picture. So people are old in other regions in Italy and in other countries too. I'm thinking about Japan. And Lombardy has been hit harder than any other region. So it's clearly too soon to be able to isolate one factor responsible for the catastrophe. And we can just speculate at this time about the real reasons. So the choices made by authorities and hospitals, especially in Lombardy region, were definitely worse than in other places. So only patients with symptoms have been tested in Italy. Measures to stop social contact were late. Doctors were not tested if not symptomatic. And in some cases, asymptomatic doctors who tested positive have been left at work. So this is, hospitals became multipliers of contagion. Look, it looks like Italy is worse than China and South Korea, for example, but we don't know if it's an Italian problem or a European problem, because when we look at the curves in Spain, France, and Germany, well, it looks very similar, and in the United States. So we will be able to do some, more thinking about these comparatively in the future. I will oversimplify, because I have a short time, how the government handled the situation. So there were broadly two phases. In phase one, there was total uncertainty. So let's say economic risks were on top of the priorities. Politicians were doing campaigns like the mayor of Milan saying Milan doesn't stop. Okay, this is just a flu. So Italians were not taking this seriously. And we are still paying now for the decisions made 15 days ago, which seems a geological era ago, but it's only 15 days. Now there is a second phase that started the second week of March, let's say, in which the government started giving support to companies and workers, layoffs, even though I have to say precarious casual workers are the most marginalized and hit and in real danger, and there is not much to protect them. And there were more restrictive measures. So only essential businesses allowed, restrictions to movement. Now, let me say something about essential businesses, because the interpretation of what is essential is key. So the lobby of the industrials has been advocating for broadening the list of essential activities to keep going with everything. And look, it's totally anecdotal, but all of my family is working still. And they don't work in hospitals, or they work in many businesses that are not essential, but still working, because they try to fit in the essential categories. Look, data from last week from mobile phones shows that 40% of the population, 40, is still going to work in Lombardy. So the underground of Milan, the images that we see online is packed. So it's really complicated. I mean, there is maybe a cultural factors at play. We know Italians are not famous to respect the rules, but there is a problem at a structural level. So the virus is not screened properly. Tests are not done among the population that is asymptomatic, and industrials lobby the government to keep the activities open, basically. So the virus is still spreading. Just a couple of few things about the political implications. Well, different ideological groups find different scapegoats to unleash frustrations. So on the left, we see people blaming cuts to public health spending in the past 20 years. And they blame these for the difficulties that hospitals have to handle the emergency. Right-wing people are blaming the European Union for the damages that coronavirus will do to the Italian economy. They blame Germany and France for playing against Italy, for manipulating the European Central Bank. So it's about finding different scapegoats. However, it's a fact that the right-wing populist party, the Northern League, which was at 35% in the opinion polls of support before the crisis, now it's 28%. So they lost 7 points. Why? Well, maybe there are different reasons. Salvini, the leader, changed ideas many times about this crisis. Also migrants, Salvini built a persona, like a single issue persona around migrants, and migrants are not anymore on top of the list of the agenda. So kind of he lost relevance. And I have to say that there is unprecedented support for the prime minister. So support levels before the crisis were 40%. Now they are 70%. So it's a rally around the flag effect in which people support a lot of the prime minister. So at the moment, there is a wave of nationalism raising as a public sentiment. There are expressions of xenophobia, but I think looking at the media, it's mostly national solidarity. However, of course, increased anxiety, social isolation, the lockdown will make in the longer run, I think, people more at risk of consuming online misinformation, cynical and toxic politicians who will eventually polarize the Italian attitudes and find false scapegoats to channel anger and frustration and potentially increasing hatred. So we are not seeing this now at the moment because people are thinking about hospitals and deaths. But when this will end and the economic depression will follow, well, that will be a different story for the consequences on attitudes. Finish.
Great, thank you very much, Matteo. And we'll hand over to our final speaker, Sam.
Yeah, thanks everyone. Thanks, Ben, for belatedly including me in the panel. We had talked about this, that it was possible that the outbreak would reach Kenya by the time the panel came around, and of course it has. So I just want to say there's a few questions in there about why we're focusing on political regimes. Ben asked us to focus on that because of the nature of the polis group, and of course none of us are public health experts, so I'm also going to do that to an extent. So Kenya in East Africa is a presidential constitutional republic. It has a population of about 48 million people and a poverty rate, using World Bank figures from 2015, with poverty measured at $1.90 purchasing power parity per day, a poverty rate of 36.8%. So it's quite high. The country had a new constitution in 2010 that delivered a devolved government. So they now have 47 counties, and the counties are responsible for healthcare by and large, but they all have a very low capacity on all fronts. The counties were only formed in 2013, and there have been myriad problems in building their capacity. I know that's a bit of a fraught phrase, but building their capacity to be able to govern and administer budgets and decision making. And there are also really huge inequalities between counties, which speaks to some of the things some of the other speakers have said. So a county like Mandera up near the border with Somalia would have, you know, to give you a kind of, I guess, evocative example, they would have about 100 or 120 students per classroom. And in Nairobi, it would be more like 30 or 40. So the differences between the counties are really significant, and some are really desperately poor and others are much closer to middle income. It is a multi-party democracy and has been since the 1990s and particularly effectively since the 2000s. But the political parties are typically not programmatic. The parties change frequently, who is in alliance with who, what the party is called, basically everything about them. And they tend to revolve around the personal ambitions of particular politicians, often allied with ethnic groups, but I want to caution against being too reductive about that idea that political parties are all ethnic parties. It's obviously a bit more complicated than that. And because, in part because of this lack of programmatic politics, it is a largely, in terms of political culture, Kenya is deeply patrimonial. And at the moment, that the political elite who have control of the government are deeply resented. As James said about Iran, there's very, very little trust in government. There's been a slow but reasonably steady closing of democratic space over the last 5 years or so. There has been an economic downturn in real terms. In official terms, there hasn't, but most people are much poorer now than they were 5 years ago. And there is a very widespread and very, very deep resentment of political and economic elites in the country. And in many ways, that's actually a more important feature of the political landscape than the political system per se. So I don't have a lot to say about the outbreak. They reported their first case on Friday, the 13th of March in Nairobi, an overseas traveller who had come from the UK. As of today, they have 12 cases, no community transmission yet, all the cases of people who have come from overseas. And that is generally a similar pattern to most other countries in Africa. So mostly they've been recently hit the week before last, typically. They typically have a small number of cases, and most of the cases are imported by people who have been in Europe or the US. These figures have been questioned by the World Health Organization on the same grounds as in many other places, that there has been poor testing and poor reporting. So it is likely that the cases are higher than that, but they are certainly sort of at the very beginning phase where we were maybe a month ago or a bit longer. So to give you a quick overview of the ways in which the government has handled the virus, like everywhere else, it's emerging and it's changing very rapidly. If you wanted to kind of have an overall characterization, I guess you could describe it as something like a partial shutdown. And remember, this is with 7 cases. So after they found their 3rd case, they closed all schools. I'm getting a message saying my internet connection's unstable, so jump in if I'll just persist and hopefully it will carry on. So they closed schools after 3 cases. They banned all public gatherings, including political rallies and religious services. There's been a ban on open air markets, which has been very controversial. Just over this weekend, they announced a number of social distancing measures, including restaurants moving to takeaway only. Bars will be closed from tonight. Public service vehicles now have passenger limits, which I'll talk a bit more about, and funerals are restricted to immediate family. They also closed borders after about 5 cases. They closed their borders to all foreigners coming from a COVID-affected country. But that has only very recently meant neighbouring countries. Uganda just discovered its first case. Tanzania did, I think, 4 or 5 days ago. And in any event, the borders with neighbouring East African countries are very porous. It's not at all clear that they will be able to do anything like closing those borders. But at the moment, that's more of a problem for the neighbouring countries than it is for Kenya. Everyone arriving in Kenya has to go into 14 days of isolation. They've urged companies to allow employees to work from home, but of course, professionals are a minority in an economy that's predominantly informal. They're doing a program called Nyumba Kumi, which means 10th house, where they're doing random screenings starting this weekend to see if they can identify any clusters of the virus that they haven't seen yet. And there are daily briefings from the government, including via Safaricom, their kind of major phone carrier. The World Bank has given them an enormous amount of money. They've given $14 billion in total for surveillance, treatment and infrastructure. I think I did this on Friday. I think that $14 billion is global, but certainly there's been a very large donation to Kenya. And they're also establishing, the Kenyan government is establishing a national food reserve system to correct market distortions related to food. So it's a bit of a sort of, not unlike here, a bit of a kind of hodgepodge of different measures that they're taking. So in terms of what that means for understanding the politics of the virus in Kenya, and of course, we can't generalize to other African countries, but I do think that some of these points I'm going to make will be relevant in the region more widely. There's three main points that I want to make. The first is about existential insecurity. The second is about whether or not this might be the straw that breaks the camel's back. And then the third will be about Africa's unique experience with public health management. So the first of these points is that existential insecurity of the kind that we are experiencing, most of us for the first time, those of us who grew up in Australia anyway, that is basically the norm in Kenya. It's a new level of threat for us, and in many ways it is a new level of threat for them as well. But the experience of being out of control of your health and unable to rely on healthcare is pretty typical, and is connected to a bunch of other, obviously driven by poverty, but also connected to the state's capacity to provide for its citizens. So according to UNICEF, for example, if we're to talk about sanitation, 59% of Kenyans have access to running water, 29% to sanitation, 9.4 million people drink directly from contaminated water sources, and only 14% have hand washing facilities with soap and water at home. So that casts, I think, it's difficult not to despair over that kind of information, given the importance of hand washing and combating the virus. In terms of access to healthcare, anyone who can afford it usually will go overseas for any serious healthcare, to the US or Europe. They do have a national health insurance fund that they're trying to roll out nationwide, but it probably wouldn't cover COVID care. It's not clear at this point. There's a lot that it doesn't cover. And there's also a very high proportion of the population that don't have it, probably 80%. There are also high rates of other diseases that make people vulnerable, like HIV, TB, and malaria, a bit like what Danielle was saying about North Korea. So I just want to read a quote from a friend of mine who posted on Facebook, which kind of captures this idea. She says, "You will die of cholera, malaria, pneumonia, getting hit by a boda or matatu," so like a motorbike or a minibus, overspeeding, drinking like homebrew at a club, giving birth, eating mutura at Muthura Market, which is like a blood sausage, protesting on the streets, a police encounter at night, or the depression that Uhuru Kenyatta, the president, is putting on you before you die of coronavirus. So that sort of puts it in a bit of perspective. The second point is about, in terms of, one of the things Ben asked us to reflect on is whether or not the virus might be a contributor to regime change or other forms of political change. And I think, like in most places, it's much too early to say, but, and I'm not particularly optimistic that it will, but it is possible that it could be a kind of straw on the proverbial camel's back, in the sense that what makes Kenyans so vulnerable is the kind of deep entrenchment of poverty and the lack of service provision. And people's fear is heavily exacerbated by that. So some of the things that contribute to that are overcrowding, which means people can't social distance. A poor education system means that it's difficult for people to tell the difference between expertise and fake news. A number of rumours, troubling rumours, have taken hold. For example, that Black people are immune to COVID. There is a high dependence on extremely crowded public transport. People are vulnerable to exploitation, for example, people offering fake tests or fake medicines. And in the words of another friend of mine, most people, if they get COVID, will beg, pray, and wait to die. And so, you know, that might be enough for people to rethink whether or not there's anything they can do about the political system, but it's not entirely clear what it is that they would be able to do. The other thing, of course, is that the government shutdown could be a trigger to regime change, because people can't shut down. People will starve to death if the government shuts down completely. It's just not a possibility. Some of you might have heard Imran Khan, President of Pakistan, talking about this, about how, you know, if it's a choice between starving people and allowing the virus to let rip, then it's a terrible choice, but it's a different choice in some countries than it is here. And then the third point that I wanted to make is a bit more positive. It's optimistic. I'm sort of artificially leaving on an optimistic note, which is that Kenya and many other countries, African countries, are actually much more experienced at public health than we are. They have expertise from Ebola, although Kenya's not had a major Ebola outbreak. They're good at information dissemination, much better than we are. They're more willing to take drastic measures, even though it's not clear if they'll be able to sustain them, particularly the economic shutdown. I might leave it there, just on the point that they might be more willing than we are to do what is required in some ways, because of their experience of other public health crises. Thank you.
Okay, thank you, Sam. And thank you to all our speakers, the 5 speakers. I put them under a lot of pressure to do this fairly quickly, and I'm really grateful to them for responding and for coming up with really such insightful analysis, and it's very rich. We've had a few questions. I'm going to say that I'm doing my best to kind of keep track of the questions as I've come in. We won't have time because we've really only got a few minutes left to ask them all, but I will put a few of them forward, and perhaps I'll do a few in a group, and then whoever feels they can respond to it will respond. Just ask you to keep your responses fairly brief. So there's one here from Nazanin, which I think is a very interesting question. It's for Danielle and James specifically, but others may want to comment on it later. I've seen some peace activists talking about cooperation around COVID-19 as an opportunity for peace and engagement. And I think that's an angle we haven't quite touched on that's quite interesting. What are your thoughts on the way that North Korea or Iran, the COVID-19 might present, in a sense, an opportunity for renewed dialogue and engagement on the international stage, particularly with those two regimes? There's a couple for Matteo about the Belt and Road Initiative, and I too have read a little bit about this. So I'll just read the question. There's a couple, but I'll read the one from David Marshall. He says, how does the Belt and Road intersect with the Italian pandemic crisis? And perhaps Cheng may have a view on this as well. Was the Lombardy region economically and culturally connected to the origins of the virus, or did it arise with speed because of a political and cultural connection that was stronger than a great deal of the rest of Europe? And so it's sort of about the role of Belt and Road in Lombardy. And let me skip over, and there's one for Sam here as well. Again, from David Marshall, can you tell us a little bit about the ethnic diversity of Kenya? And does that, you talked there a little bit about it being patrimonial sort of political system, and you said we've got to be careful in not reducing the politics to a simple kind of ethnic divide. But do you want to tell us a little bit about whether or not ethnicity and diversity is playing a role in the political response to COVID? So they're kind of questions, I think, for all of you. So if you can just one at a time, perhaps in the order that the speakers went, if you want to just chime in and say your piece, and we'll see how we go. So that would be Cheng first. Cheng, if you want to go first.
Okay, thank you, Ben. Thanks for the questions. The Italian, the connection with the One Belt, One Road initiative, honestly, I don't know much about the scale and the presence of China's investment in Lombardy or in Italy in general. But I guess my quick points are to try to make this can be made of a story, I think, but it has a lot of holes in it because firstly, if we talk about the One Belt and Road link, certainly Pakistan is much closer to China. China's Belt and Road Initiative has a much bigger presence in the country. But Pakistan has only a few hundred cases so far. And also the United States has stayed out of the Belt and Road Initiative, but the US is now coming up quickly as the third largest country in terms of cases. And also, you would think that China itself, the other provinces, would be more affected than any other places else. So I think I've seen this kind of a theory appearing in the Federalist or the Red State kind of website. That's from the United States, the more conservative websites. There's some kind of narratives about this going on. I will stop here.
So Nazanin's question on peace and engagement, I think I saw one of the tweets you're probably referring to, Nazanin, and I thought it was a wildly optimistic spin on COVID in terms of this being an opportunity for engagement with the US. I mean, that's something that, I mean, arguably a big COVID outbreak in North Korea would lead to more engagement with North Korea because it would need to invite the World Food Programme back in and the World Health Organization back in. But there is something to be said from North Korea, I guess, negotiating from a position of strength. I don't know. I will say something very, very quickly. I do think it's bad for inter-Korean relations, which is what I've been quite interested in. The Moon administration had been looking this year to increase tourism to North Korea as kind of a peace offering to help the North Korean economy, believing that it might get around sanctions in that way. And North Korea, of course, has responded to COVID by shutting down completely the tourism infrastructure between North and South Korea, and it doesn't look like that. I mean, that will certainly not change, and you can't blame the North Koreans really for shutting that down, and likely then the rest of the year. So it looks like Moon Jae-in's peace plans are fairly dashed, which will be bad for his presidency too. So there's a whole lot of kind of unintended consequences. I'll stop there.
Just building on what Danielle said from Nazanin's question, I think I would suspect, and I don't have any evidence for this, I'm just basing this on what I suspect, and I'm just speculating, that I suspect that Iran would be looking for a way to rebuild relations, any opportunity from this. It's the Homer Simpson one of crisis, a crisis and an opportunity. The main problem, of course, is actually coming from the United States side. From my opinion, at this point in time, Donald Trump has his own agenda, and part of that has to do with Iran. He's getting rid of the nuclear agreement, of course, has caused a lot of bad blood. Rouhani, the president, is in his last term. He's had a disastrous second term, a very successful first one and a disastrous second one. He would be looking for some sort of legacy, but Trump, with an election year, the whole nuclear agreement being part of his destroying of Obama's legacy, I don't know if there's really anything that can happen in that stage. But they'll be looking to talk to Europe about getting things sorted with the United States so they can trade with Europe. And look, I've got a feeling that the virus will be used to cover up other things. And I'm not just talking about Iran. Everyone's talking about a recession. That recession was being talked about last year. It was going to be on the way. So it may be the case that this is also a way of diverging from other problems, but it all depends on how long it lasts. Thank you.
Yep. Just a comment on the origins of the virus in Italy. As far as we know, it came from Germany, not from China. So apparently it's still unclear because patient 0 has not been identified 100% yet, but it looks like it's a German person who was in contact with someone in China in a business trip, and this is where then came to Italy and infected a person near Milan, and this is where it started. There are many theories about the virus being already in Italy before that patient 0, but we don't really know. But yes, there is Lombardy, nonetheless, has a strong relationship with China. And actually, at the very beginning, one of the first measures that the government took was to block all the flights from China. And not only the Chinese community, but also many Italians, especially in Milan, protested against this. And they organized immediately a chopstick day in Milan, in which they all went to eat Chinese out to protest against the flights block. And probably this is one of the places in which a lot of people got infected as well. But yeah, so I don't think it comes actually from any specific, let's say, connection or the Silk Road or related to the Silk Road.
Thanks, Matteo and everyone. I'm glad I don't have to talk about that. So David's question about the ethnic makeup of Kenya. So Kenya is made up of a large number of small ethnic groups. There is no single dominant group, no single numerically dominant group, but there are a few groups who have had more access to foreign resources historically, and because of their close connections with the colonial government, and they basically inherited the colonial state and were able to construct it and build a political culture as well as a constitution that favoured them. And that's one of the main reasons why there is, as I said, a vast difference between the capabilities and the capacities of the different counties to provide even the most basic of services. So I think that's probably the most pertinent question, or that's the most pertinent line of inequality. And it's a deeply historical one, as in many other parts of the world, including here. This is really kind of bringing out political problems that have been around for a much longer time than the virus. But I would say, like Matteo said about Italy, there's also a very nationalistic response that Kenyans know that they're in it together. They know that the virus doesn't know the difference between a Kikuyu and a Luo and a Somali and a Nubian. And they know that their fates are very interdependent in this moment. And yeah, I don't want to be naively optimistic by any stretch, but you know, there could be something in that in terms of building some national unity, but much of that will depend on how the government responds when different communities are affected.
Okay, great. Thank you for all of those responses. I've been told we can keep going a few more minutes, so if we're happy to keep fielding questions, people can keep writing their questions and I'll try and curate them. It is a bit hard to keep up, but there was a couple of interesting ones, one from Umut and another one from Nazanin, both around this idea of refugees and how it plays into the broader refugee crisis. Europe, of course, is facing refugee crisis, as are many places in Africa and the rest of the world, really. So I wonder if perhaps Matteo talked a little bit about scapegoating, if he wants to pick up on how that may or may not play out with the refugee crisis in Europe, and also Sam, if you want to talk anything there about that, and anyone else if there's scope to do so.
Look, I think in practice, one of the first practical ways in which the situation, the emergency is affecting now the migration, is that the NGOs who were, let's say, assisting migrants and rescuing migrants in the sea are not operating at the moment. This means many things, among which we have seen a decrease in people who left Africa to enter illegally in Italy through the sea. Another consequence is that I have seen a few articles in the newspapers talking about how coronavirus is starting to affect migrants who live in shelters and refugees. And this will be a very huge problem. At the moment, there hasn't been a major outbreak yet in that population, but if it will be a real issue. But as I said, at the moment, it's incredible. I mean, before the crisis, everything was about migrants and migration. After the crisis now, no one is talking about migration anymore. It's all about health. That's it.
Yeah, I can say a couple of things. Yeah, it's an excellent question, and also one that causes me some despair. In so far as what Matteo is describing about Italy is the same everywhere. People are being called home, which means that many humanitarian workers are leaving. People are diverting resources to their own nationals, as we are about to do here. And obviously that, that's a huge and incredibly difficult, really impossible debate to have now about whether we care most for our own or for others. And that is going to cause enormous problems for countries like Kenya and Lebanon, who host, not tens of thousands, but millions of refugees. Kenya has two of the biggest refugee camps in the world, Dadaab and Kakuma. They are at the extreme end of problems with sanitation, overcrowding, lack of access to healthcare, and so on. One of them, Dadaab, is near the border of Somalia, and they think that there are, I've heard informally and anecdotally that there will be, Somalia has some cases, and they will cross over because those borders basically don't really exist. You can literally just walk over. So that's very alarming, and I think, I feel like I have nothing to say except to use the very strongest language, that it is something about which we should be despairing. But I guess the other thing that I would say about migration is that, and the Zollberg Center at the New School for Social Research in New York have done some interesting online seminars on this in the last few days. I might have some coming up. What we're experiencing now, closed borders and limitations on our freedom of movement, has been the norm for many people all over the world for a very long time, including all those people who live in those refugee camps. And I think it's an interesting moment for us to think about using our personal experience and our sort of, effective and embodied experience of containment to think about and imagine what it must feel like to lead a whole life like that. And I think that's another one of the sort of possible unexpected silver linings that could come out of this is that having a sense of what it means to not be able to move from a desperate situation might be something that we could mobilize politically when we start to recover.
Yeah, thank you, Sam. That's actually a great point. And I've been saying that a lot to my neighbours and friends who are complaining about not being able to get toilet paper, saying, well, in most 90% of the world, you can't get what you want when you need it. So it's a good lesson for all of us in the first world, certainly. Well, I think we'll bring it to a close. I really want to thank our 5 speakers for really taking the time to put together some great insights into a diverse range of different contexts. It's certainly not the end of this. I think we all know that there's a lot more in the coronavirus to come, and that we're going to see it evolve and change the world in ways we can't even think about now, both politically and in other ways. But one good outcome is we're learning how to collaborate on things like Zoom and do these kind of presentations. So despite our very strange false starts, we got there in the end, and thank you all for persevering. Anyone who's not on my email list for the Polis events and activities, please do get in touch and I'll add you, because we do host these kinds of things very regularly, and we'd love to have you involved in the future. So thanks again, everyone. Look after yourselves, stay healthy and stay well, healthy mentally and physically, and look after each other, and we'll be in touch. Thank you.
Thanks, Ben.
Thank you, Ben.
Thanks,
Ben.
everyone.
Thanks, everyone.
Take care.
Bye.